Hello there. I want to invite you to look at this baby. Would you just look at him? I know what you're probably thinking right now. Wow, that baby's so cute and precious. And you're right. You're also maybe thinking, who is this man? Why is he showing me this baby? Well, I want to ask you something. Who or what do you think would ever want to harm this sweet, precious little baby? Well, I want to talk to you about that today. My target audience today is healthcare professionals. Oh, hello. I didn't see you there. My name is Trey Wisdom, a nurse practitioner student at Auburn University Graduate School of Nursing. So the question I asked you earlier was, who or what could ever want to hurt that precious little innocent baby? Well, we can look at it in two ways. People who refuse to get vaccines, and the diseases themselves the vaccines are meant to protect against. So I'd like to take you back to a time in the UK, not too long ago, or at least it doesn't seem like too long ago, in 1974, where many British parents decided not to vaccinate their children with the pertussis vaccine, thanks to a report linking the pertussis vaccine to 36 neurological consequences secondary to obtaining the vaccine. This decreased the vaccine uptake of the pertussis vaccine from 81% in 1974 to just 31% in 1980. Luckily, there was a reassessment of the vaccine efficacy among the UK population, and the disease incidence rates declined significantly. So, to further put emphasis on this, I want to point out to you that with the recent anti-vaccine movement, the United States alone has seen measles outbreaks in 2008, 2011, 2013, and probably the most famous one being between 2014 and 2015, where 125 people contracted the measles disease at Disneyland theme park. So, as healthcare professionals, what do we do? What can we do? Well, as possible resolution to this issue, I implore all healthcare professionals, as we have a strong influence on the community, on our states, on our country. We have an amazing opportunity to help people with this. We, as healthcare professionals, if I asked you what made you want to get into this field, I would venture to guess that majority of you would say to help people or to make a difference. So what the evidence tells us is the trust factor between healthcare professional and patient or parent. We as healthcare professionals must establish rapport with our patients and parents of children if we are pediatric nurse practitioners in order to help eradicate this anti-vaccination movement. Evidence shows us that the trust factor, that patients and parents that trust the healthcare professionals are more likely to adhere to the vaccination regimen. So, establishing that trust factor is critical for us as healthcare professionals if we want to do anything about this anti-vaccination movement. Vaccines have the wonderful ability to eradicate diseases that have plagued mankind for years. Why on earth would we ever want those diseases to come back? Much less possibly worse than they were before. So as healthcare professionals, we must also educate our patients on these vaccines. If we don't establish trust and we don't educate properly, our patients and the parents of these children that we're trying to protect and help are going to seek other sources of information, like social media and the internet in general, where myths about vaccines abound like no other. So in our practice, give the patients and parents proper information about vaccines, evidence-based information that's easy for them to read and understand. Because once you've established that trust and you can give them that proper education, vaccine uptake can increase. And you and I can protect precious little angels such as this one.